Hello everyone, welcome to my channel. Today I will be telling about one of the most important topic which is asked in exam as well as in Viva, and also one of the very important medical emergency in oral surgery. Yes, it is syncope. I will be telling about syncope, the definition, synonyms, predisposing factors, classification, prevention, clinical manifestation and management. All these topics will be covered in this short video. So what is the definition of syncope? It is defined as a sudden and transient loss of consciousness which is secondary to period of cerebral ischemia. It is also called atrial bradycardia, benign faint, neurogenic syncope, psychogenic syncope, simple faint, vasodepressor syncope, vasovagal syncope. The predisposing factors are divided into psychogenic and non-psychogenic. The psychogenic factors include fright, anxiety, emotional imbalance, unwelcome news, pain, sudden unexpected pain, sight of blood or surgical instruments which are kept in the clinic or in front of the patient. Non-psychogenic factors include sitting in an upright position or long standing hunger, exhaustion, poor physical condition, hot, humid, crowded environment. Here some of the images is also given, which we can observe in patient while patient is going in. The classification, it is classified into neural mediated orthostatic, that is the long standing one, the cardiac arrhythmias and cerebrovascular. This is a small image where you can see as it's like for remembering purpose. Final year students, they can just make a mnemonic like syncope, as stands for situational syncope, Y for vasovagal syncope, younger fainter, neurogenic syncope, cardiac syncope, orthostatic syncope, psychogenic syncope, and lastly the E is the endocrine related, that is low. Now the prevention part, the most important part. It is often asked in VIVAS and exams also, interviews also. How do you prevent a patient who can go in syncope? So first of all, the most important one is proper positioning of patient. You have to relieve anxiety, console the patient, make him assured that everything will go all right. Every potential patient must be recognized and evaluated for presence of dental anxiety. You have to do this on your own in the clinic. Medical history should be taken carefully. If patient has any medical history of previous syncope, then he should be given a special consideration. Now, on the basis of clinical manifestation, we have pre-syncope, syncope, and post-syncope. Clinical manifestation of pre-syncope. Early symptoms, we can see the feeling of warmth. There is loss of color like pale skin tone. The late symptoms include pupillary dilatation, yawning, hypercapnia, cold hands and feet, hypotension. There may be visual disturbances, dizziness, and loss of consciousness. The clinical manifestation of syncope. So once the patient is in syncope, you can see breathing irregularity, jerky movements, that like appearance, and pupil becomes dilated, bradycardia, pulse becomes weak, and the BP is decreases. So there may be nausea, stress, and extremely low body temperature, dizziness in case of vasovagal syncope. Now the clinical manifestation for post-syncope, the patient becomes paleness will continue, nausea, weakness, sweating for few minutes to hours, short period of mental confusion, disorientation, BP and heart rate are normal, tendency of second attack if allowed to stand or sit too soon. Now this is the pathophysiologically, it is mainly important for the final years who are going to give the final year examination. If there is a long note of syncope in exam, they can include the pathophysiological path in the same arrow formation, because it can give you more marks if you make some diagrams or do answer in like this arrow points because it gives clarity to the examiner who is checking your copy. So you can take this note also. Now the management part for pre-syncope. Once you see the patient is about to go in syncope, you have to just stop the procedure then and there. Then the patient should be placed in supine position. The legs are slightly elevated. That is, you can just change the position of your dental chair. Then check airway, breathing, circulation. Now, if the patient is in syncope, you have to first assess the consciousness, call for assistance immediately, position the patient, placing the patient in supine position, assess an open airway, assess circulation. If patient continues to remain unconscious, call upon medical assistance immediately. Administer oxygen, and the next step is monitor for the vital signs, provide definitive. The post syncope part. Uh, Once the syncope phase is gone and the poor patient is in post syncope phase, you have to follow these rules or this treatment. Loosening of the clothes, respiratory stimulant, aromatic ammonia may be given. Cold on patient's forehead, blanket can be placed. If bradycardia persists, anticholinergics, atropine 0.5 mg can be given. Patients should not be subjected to additional dental care. Yes, you have to stop the procedure anyhow. It has to be done in pre-syncope phase as well, but somehow if you fail to notice that the patient was in syncope and the patient came into the post-syncope phase, then obviously you have to just avoid giving any additional dental care. The possibilities of second episode of syncope during this period of time. Okay, so the prior to dismissal, the doctor should determine from the patient what the primary precipitating event present, such as hunger or fear. Now, what are the precautions which can be taken is controlling the predisposing factors like fear, anxiety, or if the patient has not been taken his breakfast before the patient enters the treatment area, it should be made certain that patient has eaten recently. Yes, a comfortable environment, temperature and humidity in the office, stress reduction modalities can be employed, sedation through variety of drugs, reducing anxiety and proper positioning of patient. Now, if the patient has bradycardia, then immediately you need to stop the procedure. Any dental treatment which is going, loosen its tighten clothes. Place the patient in head low position with lower limb elevated. Okay, and if the pulse is normal, sprinkle cold water. Despite of doing all this, if still you see bradycardia still persist, you can just give injection of atropine 10 to 50 milligram intramuscular, and if the patient is still not responding, support respiration, start oxygen. So the conclusion is syncope is a common symptom often with dramatic consequences which deserve thorough investigation, appropriate treatment of its cause. So this was just a short kind of note of syncope which I tried to include overall. If you are preparing a note for your final year exams, or if you are preparing for any kind of exam, I have tried to include all the questions. If you can just go through this PPT, it's more than enough for your one of the medical emergencies. So next upcoming, I will try to cover the management of adverse effects of local anesthesia. So don't forget to subscribe, and also let me know in comment section if any topic you want me to cover. So don't forget to like, comment, share and subscribe, since it gives some motivation to keep going. Good things take time, so please be patient. Thank you.